our sizes, yeah.
Let's go.
Our sizes, I'm watching you. Our sizes, I'm watching you. But the lawyers, they do. But the lawyers, they do, yeah. But the lawyers, they do. But the lawyers, they do, yeah. Talking about human rights, talking about legal rights. If you're wrong, you can be right. What is right can never be wrong. Our sizes, I'm watching you. Our sizes, talking about human rights, talking about legal rights. If you're wrong, you can be right. What is right can never be wrong. Our sizes, I'm watching you. Our sizes.
Gentlemen, are we ready to go on?
Yes, my lord, we are ready.
Yes, my lord, we are set.
Dr. Farida Bukashwa,
Yes, my lord.
please step into the witness box.
Very strong.
Yes, my lord.
Remind witness of previous oath.
Yes, my lord.
My lord. Do you still remember your previous code?
Yes, my lord. I still remember my previous oath.
My lord, witness has just been reminded of her previous code.
Cross-examination.
All witnesses in this case that have not testified should go out of court and out of hearing. Thank you, my lord. Dr. Farida Bukashwa, am I right?
Yes, my lord, you are right.
Dr. Farida,
Yes.
what are your educational qualifications?
From which level?
From post-secondary level.
My qualifications are many, but I will mention a few. I had my MBBS from the University of Nigeria, Nsukka. My master's in traumatic surgery from Carleton University, Ottawa, Canada. PhD in ART techniques from Brunel University, London, UK. PhD in advanced IVF processes, Rockefeller University, New York, USA. PhD in obstetrics and gynecology from the University of Lagos, Nigeria. PhD in endocrinology from the same university, among others.
Thank you, Doc. As a medical expert in fertility treatment, what is IVF?
In vitro fertilization, abbreviated IVF, is one of the assisted reproductive technology, ART, frequently called IVF. The IVF is a method of fertilization by extracting eggs, getting a sperm sample, and physically combining an egg and sperm in a test tube. The resulting embryo or embryos, as the case may be, is conveyed through the lower abdomen using a laparoscope to the uterus. Other experts have adumbrated on other ART techniques, so we will not give details here.
Thank you, Doc. Why is IVF now popular in Nigeria and globally?
Generally, I must say here that infertility is now a major health issue. And many couples want to have their own babies they are genetically connected to. For both the male and the female couples, there are 6 reasons why the need for the treatment of IVF arises. First is the blocked or damaged fallopian tubes of the woman. The second is the main factor fertility challenge of depreciated sperm count or sperm motility. The third consideration is the women with ovulation disorders, premature ovarian failures, uterine fibroids. The fourth challenge is the women who have had their fallopian tubes removed. The fifth contemplates individuals with genetic disorder. The sixth, but not the least, is unexplained infertility issues. The combination of one or more of the adumbrated factors made for the demand for IVF treatment imperative.
Dr. Farida, as an expert in fertility treatment, what are the treatment what are the fundamental stages of treatment in IVF treatment?
I must say here that there are 5 fundamental stages in the IVF and embryo transmission procedure. Stage 1, fertility medicines that stimulate egg production are given to the woman frequently. Many eggs are desired because there are scenarios where some eggs will not get fertilized after retrieval. Normally, transvaginal ultrasound is applied to examine the ovaries. Blood test samples are obtained to the level of hormones.
What is the next stage?
Stage 2, ova or egg gotten through a small surgical method that applied ultrasound to guide a needle vibe or through the pelvic to extract the egg. Notably, medications are applied prior to the procedure to minimize pain. Stage 3, the man is requested to generate a sample of sperm, which is made ready for blending with the ova or egg.
Is that all?
Stage 4, here, the procedure of insemination is brought into play. The sperm and the egg are combined together and kept in a laboratory dish or test tube. I must say here that the word test tube baby got its origin from this laboratory dish. But where the motility rate of the sperm is low and difficult to attain fertilization, intracytoplasmic sperm injection (ICSI) is applied. This procedure involves the removal of a single sperm from the man, and same is directly injected into the ova in order to attain fertilization. There is surveillance on the egg to establish that fertilization and cell division has occurred. As this happens, the fertilized eggs are confirmed embryos.
Doctor, you said earlier that there are 5 stages. Which is the last?
The last but not the least stage is number 5. Here, the embryos are normally transmitted into the woman's uterus 3 to 5 days following retrieval and fertilization. A small tube or catheter is put into the woman's uterus via the lower abdomen to transfer the embryos. I must say here that this procedure is frequently not painful for women. The worst case scenario, some get crampy feelings. Where this method is successful, implantation happens, normally around 3 to 5 days following egg retrieval. Implantation is the process of the embryo attachment to the wall of the uterus.
Thank you, Dr. Farida. It is true, infertility clinics charge infertile couple heavily for the treatment, taking advantage of their situation.
My lord, I object to this question of my learned brother.
Your grounds?
My Lord, the question is an infraction on Section 228 of the Evidence Act 2011, laws of the Federation of Nigeria as applicable to Ogun State. My Lord, the question is intended to insult and annoy the witness.
Objection overruled.
As the court pleases. In your evidence earlier, you are a gynecologist.
Yes, my lord.
What is gynecology?
But I want to quickly say here that the cost of IVF used to be astronomical because of the medicines and materials applied. However, it has come down greatly. And there are many sponsorship programs now. The infertile couple pay less. No time to expatiate here. On the question, what is gynecology? It is the science of the disease or malady that afflicts women, with particular reference to genital, urinary, and rectal organs.
My Lord, my last question, Dr. Farida. As an infertility doctor, are there side effects in IVF treatment?
I must say here that it is advisable for the woman not to rush into stressful activities. However, frequently, most women resume their usual activities a day after the procedure. The side effects are about 5. 1. Passing a little quantity of fluid may be clear or blood tinged after the treatment regimen. 2. Mild cramping. 3. Moderate bloating. 4. Light constipation. 5. Breast tenderness. That is all.
My Lord, my most final question.
I'll object to this question, my Lord.
Your gravamen?
My Lord, in the question before this, she informed the court that it was her last question. Now, most final question.
Okay. Professor Bakara,
Yes, my Lord.
make it your last question. You limited yourself in the first place.
Thank you, my Lord. It is true. Medications are applied before and after the IVF treatment. Are there no side effects?
It is true there are side effects, just like most medical methods. However, they are not life-threatening and therefore worth the trouble. They include but not limited to headache, mood swings, abdominal pains, hot flashes, abdominal bloating, and in rare occasion, ovarian hyperstimulation syndrome, OHSS. Finally, there are risks connected with IVF procedure. They are nausea or vomiting, decreased urinary frequency, shortness of breath, faintness, severe stomach pain and bloating. Frequently, 10 pounds weight gain within 3 to 5 days. That is all.
My Lord, that will be all for this witness.
Professor Janet Ereku,
Yes, my Lord.
any re-examination?
Nay, my Lord.
Registrar,
Yes, my lord.
step down the witness.
Yes, my lord. Dr. Farida Bukarshwa may step out from the witness box.
Gentlemen, suggest a date.
My Lord, subject to the overriding convenience of this honorable court, would suggest 28th of next month.
Court, this case is hereby adjourned to 28th of next month for continuation of hearing.
As the court pleases.
The court will rise.